Ulipristal tablet is used by women to prevent pregnancy after birth control failure or unprotected sex, such as a broken condom. It is an emergency contraceptive and should not be used as a regular form of birth control. It will not stop an existing pregnancy or protect against sexually transmitted diseases. This medication may not work well in women who are overweight or if you are using certain other medications, which can result in pregnancy. It is important to talk to your doctor for more details and to see if this medication is right for you. Before taking Ulipristal, make sure to read the patient information leaflet from your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. When taking this medication, it's best to take one tablet by mouth as directed by your doctor, with or without food, as soon as possible after unprotected sex. It works most effectively when taken within 120 hours, 5 days, after unprotected sex. If you happen to vomit within 3 hours of taking the medication, it's important to contact your doctor to see if you need to take another dose. After taking Ulipristal, you may notice changes in the timing and amount of your period. If your period is more than 7 days late, it's important to inform your doctor and you may need to take a pregnancy test. It's also important to use a barrier-type birth control, like condoms or a diaphragm, every time you have sex after taking this medication until you have your period. If you plan to use hormonal birth control, wait at least 5 days after taking Ulipristal before starting hormonal birth control, as these medications may interact and make both drugs less effective. Even after starting hormonal birth control, continue to use a barrier-type birth control every time you have sex until you have your period. If you have any questions or concerns, be sure to talk to your doctor about reliable forms of birth control. Some common side effects of Ulipristal tablet include headache, nausea, abdominal pain, tiredness, dizziness, or painful menstrual periods. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's worth noting that your doctor has prescribed this medication because they believe that the benefits to you outweigh the potential side effects. In fact, many people using this medication do not experience any serious side effects. However, if you do experience severe lower stomach pain, especially 3 to 5 weeks after taking Ulipristal, it's important to contact your doctor right away. While it's rare, a very serious allergic reaction to this drug is possible. If you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or difficulty breathing, seek medical help immediately. This is not an exhaustive list of possible side effects, so if you notice any other effects not listed above, be sure to contact your doctor or pharmacist. As for the optimal timing and dosage, it's best to follow your doctor's instructions. If you have any concerns or questions about the medication, be sure to consult with your healthcare provider. Before taking Ulipristal, it's important to let your doctor or pharmacist know if you have any allergies to it, progestins, or any other substances. This medication may contain inactive ingredients that can cause allergic reactions or other problems. Before using Ulipristal, make sure to inform your doctor or pharmacist about your medical history, especially if you have unexplained vaginal bleeding. This medication may cause dizziness. Avoid alcohol or marijuana, as they can worsen this effect. It's important not to drive, operate machinery, or do anything that requires alertness until you can do it safely. Limit your alcohol intake and talk to your doctor if you use marijuana. Before undergoing any surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Ulipristal must not be used during pregnancy. If you become pregnant or suspect that you may be pregnant, notify your doctor immediately. This medication can pass into breast milk and may pose a risk to the infant. Therefore, it is not recommended to breastfeed while using this drug. Consult your doctor before making any decisions regarding breastfeeding while on this medication. Remember to always check with your doctor or pharmacist about any possible drug interactions before taking Ulipristal tablets. It's important to make a list of all the medications and herbal products you use and share it with your healthcare provider. Some medications, like griseofulvin, modafinil, rifamycins, St. John's wort, and certain drugs used to treat seizures or HIV, may interfere with the effectiveness of Ulipristal tablets and may increase the risk of pregnancy. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. And remember, if you have any concerns or questions about Ulipristal tablets, don't hesitate to ask your doctor or pharmacist for more information. If you or someone else has taken too much Ulipristal tablet and experiences severe symptoms like passing out or difficulty breathing, it's important to seek emergency medical help immediately by calling 911. Alternatively, you can also contact a poison control center for assistance. In the US, residents can call 1-800-222-1222, and in Canada, residents can reach out to their provincial poison control center. This medication is not recommended for use during pregnancy. It may harm an unborn baby. It is important to prevent pregnancy while taking this medication. Use reliable forms of birth control while taking this medication. If you become pregnant or think you may be pregnant, tell your doctor right away. When taking Ulipristal tablets, it is important to follow the dosage instructions provided by your doctor or pharmacist. Typically, this medication is taken as a single tablet with water, with or without food. It is important to take the tablet as soon as possible after unprotected sex or contraceptive failure, and it should not be taken more than once in the same menstrual cycle. Ulipristal tablets are used for emergency contraception to prevent pregnancy after unprotected sex or contraceptive failure. It is important to note that this medication should not be used as a regular form of birth control. If you have any questions or concerns about taking Ulipristal tablets, be sure to speak with your doctor or pharmacist for more information. When you have Ulipristal tablets, it's important to store them at room temperature, away from light and moisture. Make sure to keep them out of the bathroom and in a place that's not accessible to children or pets. When it comes to disposing of the medication, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper way to dispose of Ulipristal tablets. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.